Good morning, everyone. Thank you to all of our advocates and for members of the media for joining us today at the Eastside Family Support Center. It's really good to see everybody. I want to thank our speakers who are helping us launch the expansion of this really vital community safety program. They're here to help share some really important public safety news today. I'm joined by Chantel Harmon-Reed, the director of the Tacoma-Pierce County Health Department. Director Reed, thank you for your leadership. I'm also joined by Tacoma Police Chief Patty Jackson. Chief Jackson, thank you for all you do to keep our community safe in so many different ways. And then longtime community safety leader Shalisa Hayes, who's the executive director of the Billy Ray Shirley III Foundation and board member of the Alliance for Gun Responsibility. Behind us is a diverse cross-section of advocates and community leaders who work hard every single day in a wide variety of fields to ensure the safety and well-being of Pierce County residents. I want to particularly thank Pierce County Councilmember Brian Yambe, who is with us, who helped shepherd this funding of this program through the Pierce County Council after we proposed it to the council during the last budget process. Again, I want to thank all of the community advocates behind me who work really hard in so many different ways on public safety. Look, all of us know how critical it is to keep our communities safe, especially our kids. Unfortunately, we are all too familiar with how gun violence impacts our communities. Recent data show that Pierce County has averaged 22 gun deaths per year among residents under the age of 25. Half of those gun deaths are from suicide. Another 46% of those gun deaths are homicides. More alarming, nearly half of the under 25 deaths from guns are teens under the age of 20. These are the statistics that are top of mind for me today and every day when we're thinking about improving public safety. And look, public safety does not look the same to everybody. Something we can all agree on, though, is that safely storing firearms is one of the easiest ways for us to save lives. Safe storage helps prevent accidental death or injury, suicides, and violent crime. Lockboxes keep guns from getting into the wrong hands while also allowing gun owners to quickly access their firearms when they need to protect themselves or their families. The Tacoma-Pierce County Health Department is already doing good work through its Safe Gun Storage Program, distributing free gun locks to responsible gun owners across the county and educating our entire community about safe storage. But there is still a lot more work to do. That's why I'm so proud about our Tacoma-Pierce County Health Department for taking a data-driven and public health approach to gun safety. Since 2020, there have been more than 1,000 firearms stolen from cars alone across unincorporated Pierce County. This is data according to the Sheriff's Office. Of those, more than 600 of those stolen firearms were semi-automatic handguns. I want to stress something. That number of more than 1,000 firearms stolen, that's not an exhaustive number. It excludes gun thefts from homes or businesses, just for example. It also does not include data from guns stolen in our cities, such as Tacoma, Lakewood, University Place, and other cities. This is data that we have available from unincorporated Pierce County, according to the Pierce County Sheriff's Office. In short, the 1,024 stolen guns in that time frame, it is an undercount. Stolen firearms do great harm to our communities. One study found that those stolen guns are 9 times more likely to be used in a crime. But it's not just thefts that we're worried about. Far too often, people in crisis tragically use unsecured firearms to end their own lives. Guns that are properly locked up, that are not properly locked up, can easily get into the hands of kids who can harm themselves or others. And every single one of those gun thefts, they were preventable. The tragedies resulting from unsecured firearms were preventable too. We can stop the thefts and tragedies that haven't happened yet. And so that is why today I'm proud to announce that Pierce County is providing $300,000 to expand the very successful program the health department has been leading for safe gun storage. This new funding will significantly expand the health department's reach and scope of work, meeting residents where they are. It reinforces a harm reduction program that has demonstrated to literally save lives. Soon, Director Reed will talk shortly about how the program works and how this new funding will be used, but ultimately, this means more lockboxes in more vehicles and more homes to avoid preventable theft and tragedy. Gun owners know the immense responsibility that comes with owning a firearm. To those who have already used this program or are already taking steps to safely secure your guns, thank you for doing the right thing. Please know safe gun storage is not just the right thing to do, it's the lawful thing to do. Washington is one of 26 states with laws requiring safe gun storage. These lockboxes protect your family and your community, and they also protect you. If you get one, you'll be in good company. A University of Washington Medicine School study last year found that the percentage of adults in Washington who reported storing household firearms securely rose from 34.9% to 48.8%. I'm so grateful to see such a significant increase in the number of gun owners taking this common sense step to protect their families and their communities. And you can help us get that number up even higher. And that is what this funding will help us do. But we need you to take advantage of the program. I want to briefly talk about how we got here. Last year, on this very day, we convened a roundtable of experts from a variety of professions to discuss youth violence. Many of the influential community leaders behind me were at that youth violence prevention roundtable. And that was the first time that I heard about the alarming data on gun thefts from cars. Lieutenant Darren Moss from our Pierce County Sheriff's Department at that roundtable stressed to us that it's mostly kids and young adults who commit vehicle break-ins. That means a lot of those guns are stolen by our young people. Some examples from our local news. In August of 2022, a part of an auto theft emphasis operation in Pierce County, law enforcement recovered a stolen van driven by a 12-year-old who was armed with a handgun. In October of 2023, 4 teens were booked into Reman Hall, accused of 2 armed robberies in Puyallup and Sumner. In December of 2023, sheriff's deputies caught 5 teens in a stolen car with a stolen firearm in the Parkland area. They collided with another vehicle while driving recklessly. The 15-year-old driver was arrested on a handful of very serious charges. And in May last year, a group of teens in the Spanaway area robbed a gun owner at gunpoint, stealing his AR-15 rifle and a handgun in his waistband. One of our biggest priorities in Pierce County is ensuring that our youth can thrive. It's explicitly laid out in our Forward Together plan. It's our moral obligation to set our children up for success and to intervene when we see them struggling. Listening to Lieutenant Moss talk about incidents like this, I knew that we needed to do something different. And I urged my team to find potential solutions in the face of this data. It didn't take long to determine that expanding safe storage was a no-brainer. I know our sheriff's office would want me to discourage you from storing your gun in your car, but if you have to, a lockbox is absolutely essential. And that's why we're making it as easy and cost-effective as possible to do just that. More lockboxes and more cars means keeping your gun out of the wrong hands. That was how this partnership happened. The result is a low-barrier, life-saving solution that everyone watching this can be proud of. This is a perfect example of how we are moving Pierce County forward together to build communities that are safe, welcoming, and connected. Put simply, it's an example of good government. And I encourage all Pierce County gun owners to take advantage of this incredible resource. Your families, your children, and your communities will be safer because of it. And now I'd like to turn it over to Tacoma-Pierce County Health Department Director Chantel Harmon-Reed, who will talk more about the gun lock safety program and how we are expanding it in partnership with the health department. Director Reed.
Thank you, Executive Mello, for bringing us here today, and everyone, for this very important commitment to help protect and improve the health and safety of everyone here in Pierce County. The Tacoma-Pierce County Health Department will use this funding to purchase over 1,500 biometric lockboxes. We will distribute those for free at 9 of our family resources centers, much like we're here today. We're also going to be distributing them at community events, local firearm retailers, shooting ranges throughout Pierce County. The department will also continue to provide education to people around the county about the benefits of lockbox uses. Again, to the exec's point, firearm that is in a vehicle is best kept used in one of these boxes like you see here. Making sure that it's accessible and safe to all individuals is going to be the most prudent practice. This influx of funding will help us expand this work throughout Pierce County with more direct outreach, more lockboxes distributed to keep firearms out of the wrong hands. More education on gun violence prevention is going to be crucial. June is National Gun Violence Awareness Month. It is a time to recognize that all gun deaths are preventable. A properly secured firearm is far less likely to be used to commit a tragic violent act. Properly securing your firearm can help prevent, 1, suicide. In far too many cases, someone in crisis gains access to a family member's unlocked firearm. Theft. Hundreds of thousands of guns are stolen from homes and vehicles in the U.S. every year. One study found stolen guns are 9 times more likely to be used in a crime. Accidental death or injury. Our children and others can get hurt or die if they have access to an unsecured firearm. This funding from Pierce County will significantly expand firearm reduction programs in our community, and it's going to allow us to save lives. Thank you again, Exec Mello, and to everyone who is here in support of this very important work. These lockboxes are now available, as I mentioned again, all over at our family resource centers across here in East Tacoma and across Pierce County. You can learn more about the Health Department's work to curb gun violence at tpchd.org. Choose peace. Thank you. Now I'm going to turn it over to Chief Patty Jackson from the Tacoma Health Department. Police Department.
Thank you very much. Again, I'm Patty Jackson, and I currently serve as the Chief of Police with the Tacoma Police Department. And so on behalf of the department, we appreciate the opportunity that Pierce County Health Department and our community partners are including us in this discussion. We are honored to participate in the effort to share this public safety perspective on the importance of secure firearm storage. The focus of today's event is for safe and secure firearm storage, and from a policing perspective, that is an important conversation to have. In policing, we are often called after something has already gone wrong. We respond after a theft has occurred, after a child has gained access to a firearm, after an accidental shooting, or when a person in crisis has access to a weapon. Today's conversation is focused on what can be done before those situations occur. The reality is that when a lawfully owned gun falls outside of the control of its owner, whether that's through theft, loss, or unauthorized access, the effects often reach well beyond the original intent. This is especially true when guns are stolen. A stolen gun may be passed from person to person, possessed by someone who is prohibited from having it, or recovered months or even years later during an unrelated criminal investigation. In many cases, the lawful owner becomes a victim as well, having lost a valuable piece of property and the ability to control where that gun ultimately ended up. Here in Tacoma, we continue to see guns become targets for theft, particularly when left unsecured in vehicles. Last year, approximately 300 firearms were reported stolen in Tacoma alone. More than 125 of those firearms were stolen from vehicles. Those numbers highlight why secure storage remains such an important part of this conversation. Even through the first 5 months of this year alone, more than 50 firearms have already been reported stolen. This is not a problem from years ago. It is something police officers continue to encounter today. In fact, as recently as last week, officers were involved in a violent crime investigation involving a firearm that has previously been reported stolen. While every incident is different, each theft represents a gun that is no longer in the possession of its lawful owner and may create risks far beyond the original incident. That is, again, why storage is so important. Whether it's a lockbox, a gun safe, or another secure storage option, taking that extra step reduces the opportunity for theft. It limits unauthorized access, and it really helps guns keep, where they belong. Again, as police officers, we spend most of our time responding to the consequences of crime and tragedy. Efforts like the one that's being highlighted today focuses on reducing the likelihood that those thefts even occur in the first place. We appreciate the Tacoma-Pierce County Health Department and our community partners and everyone that's involved in expanding access to these resources, education, awareness, and practical tools that can make a difference. And today's event is an example of that work in action. Thank you very much. I'll let you introduce yourself now.
Thank you. Again, my name is Shalisa Hayes. I am the founder of the Billy Ray Foundation as well as the board president for the Alliance for Gun Responsibility Foundation. I just want to briefly share kind of my own personal experience as it relates to gun violence, so you all can see the true impact. As a teenager, I lost so many friends to gun violence that by the time I was an adult, I had made the conscious decision to stop going to funerals. The number was just too high. The funeral experience had become so repetitive that I became numb to death as the result of a firearm. I decided that instead of having lasting memories of the deceased lying in a casket, I would instead remember the moments we had together while they were alive. Imagine the shock and pain I felt years later when I lost my firstborn son, Billy Ray Shirley III, to gun violence, the very thing that made me stop going to funerals. Imagine the thoughts, the fear, the grief I experienced when I was forced to plan the very thing I had began to avoid, a funeral. Imagine my shock and pain after losing multiple family members beyond my son to gun violence, one as recently as 2 years ago. Regardless of what my personal experience is, I think we can all agree that it is not normal for a parent to have to bury a child. It is also not normal for us to not take action, to do more to keep our families and communities safe. As I move around the world, I meet mother after mother after mother who has experienced the loss of a child. And each time I'm reminded of the empty seats at the dinner table, how we miss seeing our loved ones' presence at holiday celebrations, how we miss the opportunity to see them graduate, their birthdays, weddings, first jobs, even grandchildren. Speaking of which, my son was his grandfather's namesake. And after his grandfather passed away, his grandmother looked at him and told him that it was now his turn to do something good with his name. Unfortunately, Billy Ray's chances of passing on his legacy, his last name, will never happen because he didn't live long enough to have children. I and his father were robbed of having grandchildren. Those are just some examples of what's left behind and what is lost when the lives of our loved ones are snatched by a bullet. Now, I realize there are those that see gun violence differently than I do. I know there are various arguments, things like, it's not the guns, it's the people. And my response to all those arguments are simple. My experience doesn't change my belief system. I'm not anti-gun, I'm pro-gun safety. I'll leave you with one last thought. From his grandfather to his aunt to his stepfather, multiple people in Billy Ray's village, the people that helped me raise him, are or have served in the military. So we are a family full of gun owners, but we are also a family who believes in personal responsibility and gun safety. So two things can be true at the same time. We can all believe in our right to bear arms while also actively supporting initiatives like this one that help reduce harm. So in my opinion, this investment gives every one of us one less excuse to not act responsibly. Please take advantage of this opportunity and lock up your guns. Thank you.
Shalisa, thank you. Thank you for your ongoing leadership statewide, and your ongoing leadership locally and regionally, and for so seriously turning your tremendous grief that so many of us could never imagine into ongoing leadership and action. For those that don't know, Shalisa, one of the many things she's done, you heard her leadership on the statewide Alliance for Gun Responsibility Foundation. But one of the other things that we're so grateful for is she turned her leadership into action after the passing of her son. And that's the only reason we have the Eastside Community Center not too far from here is because Shalisa was determined to turn her grief into action and make sure that our kids had a safe place to be around caring adults. And that's why I really love this initiative, and I love the public health approach to reducing gun violence. Again, behind me are folks who are taking a multidiscipline, multi-pronged approach to gun violence reduction. Behind me are folks who provide safe places for kids after school and during summertime, mental health services for our young people, and so many ways to get at making sure that we have safe places for kids and families all year round. And this program in particular, this is a great example of taking a public health approach to a violence prevention problem, where we meet people where they're at. You heard from Director Reed that we're distributing these where people buy guns and use guns. And we are here to work with every gun owner to help make sure that they can be responsible gun owners. So in closing, I want to really stress that, this issue really should not be controversial, as you heard from Shalisa and the previous speakers. This is something that gun rights and gun control advocates alike can agree on. And in fact, they do. We all want to have a safe community. We all want to protect our kids. We want to protect our veterans and our people in crisis. We all want to lower crime and keep gun violence victims out of our hospitals. None of us want to go to another funeral. All of them are preventable. Safe gun storage is an easy way to do all of that and make Pierce County safer. And this funding that Pierce County is dedicating to this program to help get more gun lockboxes easier in the hands of people who own and use guns. We hope that all of you will take advantage of this incredible program. I want to thank again all of the advocates behind me who I know are going to help us get the word out and continue to approach gun violence and youth violence from a public health perspective. And I thank all of you for your tremendous ongoing leadership. With that, we're here to see if there's any questions from anybody. Are there any questions?
Thank you so much for this. It's very informative. I feel like all my questions are already answered. I guess I was just wondering, like, so the money will go towards the lockbox, obviously, and also education, like outreach as well. I was curious, like, does that look like workshops or like, like in-person direct conversations? Like, what's that education like?
So a portion of the education is going to be direct because, as you can see, they can be somewhat complex. So a portion of it is to make sure that every gun owner has the ability to be able to not only use it or receive one, but be able to operate it. So you need to be able to understand how to be able to access your firearm as soon as you need to and be able to responsibly lock it appropriately so that it's not being used in an inappropriate way. So that's a large portion of it. So we have trained all of the staff members here to be able to support individuals once they come on site to receive the boxes so that they understand exactly how to use those. And then like I said, we're going to be at community events. We're going to be at the health department. We're going to be at family resource centers. We're going to be everywhere, just making sure that we can deploy them as much as possible. We're trying to stretch every dime of these funds. So we're using staff that we have at the health department so that we can make sure that, my hope is that the demand is many, and that we're going to spend every dime on securing the lock boxes. So that way, if there's opportunities for us to secure even more than the 1,500, then we will. Thank you. So biometric is you're going to be able to put your fingerprint and be able to access it very quickly. Previously, some of the boxes were the number print, numbered numerical. This will allow you to be able to put your thumb on and be able to access it a lot quicker. Yes.
Yeah. So that's new to this. I guess dispersal of lockbox. That wasn't the case before.
No, we had previously the biometric, but we had a combination because the program has been going on for quite some time. We have some combination. So we had the combination locks. We also had some of the biometrics. We received feedback. We received feedback from those individuals who previously participated in the program, and they said the biometrics is a lot easier, a lot more accessible. So we wanted to make sure that that it meets the needs of community. So we made the pivot, and now the ones that we purchase in the future are going to be biometric. Yes.
And so, I guess, do you have a figure as to how many lockboxes are given out in the previous this program?
I don't have that exact number, but I know that I know from overview of what we've purchased at least 1,000 in the past. I would have to give firm numbers. Please don't quote me on what we've actually distributed. Yes.
And let's see. When will these lockboxes be available?
Right now. Yes, they are available today. You can go to any one of our family resource centers and receive a lockbox today, and it can support you.
And I just looked into the future. Once these run out, but what's the next step?
So it's ironic you say that. We have just started some of the conversations. We want this to be, as Exec Mello mentioned, a part of our public health response to gun safety in our community. We are not only looking at how do we incorporate this into our daily practices as a health department, but then looking at opportunities around our state. Our understanding is that there is going to be some funding available through state of Washington that we are going to be working in collaboration with the county partners and some of the partners that you see here today to be securing some additional funds so that it's not only just available through the health department, but also through some of the programs that you've heard from. Thank you.
I think that ends our time this morning, and I can't appreciate the folks behind me enough for their partnership and for your interest in helping us get the word out to every single responsible gun owner. So thanks so much. Have a good day, everybody.
Thank you.
Thank you.